Imagine strolling into your yearly checkup, feeling like you're doing all the right things to stay healthy, only to find out that some of those routine tests might secretly be rolling the dice on your health. Yep, even increasing your stroke risk overnight. Sounds wild, right? You trust your doctor, follow their advice, but tucked away in the fine print of modern medicine are sneaky risks nobody's shouting about. Not your doctor, not the news, and definitely not those glossy clinic brochures. Picture this. You leave your appointment with a clean bill of health, maybe even a pat on the back, and then, bam, days later you're hit with dizziness, blurry vision, or something scarier. You're left scratching your head, thinking, what just happened? Here's the deal. Some common tests, especially if you're over 60, can quietly mess with your blood pressure, disrupt blood flow, or even spark a chain reaction that could lead to a stroke. But don't panic. This isn't about scaring you silly. It's about arming you with the smarts to ask better questions and protect yourself or your loved ones. Because after 60, it's not just about catching problems early. It's about dodging ones we might accidentally cause. So, grab a comfy seat, maybe a cup of coffee, and let's dive into the 5 medical tests that could carry hidden stroke risks for seniors, plus some easy tips to keep you safe at your next doctor's visit. If you're over 60, drop a 1 in the comments. If not, toss in a 0 and hit that subscribe button where we spill the tea on what others won't. Let's kick things off with the CT scan with contrast. You know, that test where they inject dye to make your insides light up like a Christmas tree on the screen. It gives your doctor a crystal clear view of your blood vessels and organs, which sounds awesome, right? But here's the kicker. That warm, fuzzy feeling you get from the dye isn't just a quirky side effect. For some folks over 60, especially if you've got high blood pressure, heart issues, or kidneys that are starting to act like they're ready to retire, that dye can stress out your system. It might trigger a vasovagal reaction. Don't get me wrong, CT scans can spot serious stuff like cancers or aneurysms, but they shouldn't be an automatic just-in-case test. So, how do you stay safe? Before you say yes to a contrast CT, ask your doc, is this 100% necessary, or can we try something else? Spill the beans on your health history, high blood pressure, kidney issues, heart problems, or if you've ever felt weird after a scan. And don't be shy to ask, can we skip the dye? Sometimes a regular CT or an ultrasound works just fine without the extra risk. Next up, let's talk about the stress test. That one where you're jogging on a treadmill like you're auditioning for a fitness commercial, all while hooked up to a heart monitor. Sounds like a great way to check your ticker, but for seniors with high blood pressure or heart conditions, it can be like asking your heart to run a marathon with no training. As the treadmill speeds up, your heart rate and blood pressure go through the roof, putting your system under serious strain. For a young buck, no biggie. But for us seasoned folks, it's like tempting fate. Risks include wild blood pressure spikes, wonky heart rhythms, or even tiny tears in fragile brain vessels. A 2020 study in the American Journal of Cardiology found that nearly 7% of folks over 65 had issues during these tests, like blood pressure surges or irregular heartbeats, especially if they already had vascular problems. Take Margaret, a 74-year-old from Ohio with high blood pressure. Her doc ordered a stress test just to check. Halfway through, she got dizzy and felt chest tightness. They stopped the test, but the next day, she had a minor stroke. Docs think the test's pressure pushed her system over the edge. The fix? Ask your doctor, is there a gentler way to check my heart? Sometimes a nuclear stress test, which uses meds instead of exercise, or a resting echocardiogram is safer. And if you're feeling fine, no chest pain, no shortness of breath, Ask if the test is even needed right now. Now, let's chat about endoscopies, those procedures where they send a tiny camera down your throat, or, well, other places to check your insides. Super common after 60, and often pitched as a better safe than sorry move. But here's the tea. If you don't really need it, especially with sedation, it might stir up more trouble than it's worth. Many seniors are on blood thinners like aspirin or warfarin, and when you add sedation, your blood pressure and circulation can do a little dance. Mix that with meds that mess with clotting, and you're risking internal bleeding or brain circulation issues that could spark a mini stroke. A 2021 study in gastrointestinal endoscopy found that seniors getting sedated endoscopies had a noticeable uptick in transient ischemic attacks, mini stroke for a clot. The takeaway? Don't just nod along to an endoscopy. Ask, why do I need this now? If it's just because it's been a few years, see if there's a less invasive way to check things out. Tell your doc about all your meds. Ask if you need to pause blood thinners. And see if you can skip sedation or go lighter. Next, let's talk MRIs with contrast. These scans are like super-powered X-rays, showing your doc everything from your bones to your brain. But when they add gadolinium contrast dye, things get dicey for seniors, especially if your kidneys are moving at a snail's pace. After 60, your kidneys aren't as spry, and if you've got undiagnosed kidney issues, that dye can stick around like an unwanted houseguest. Gadolinium retention is linked to a rare condition called nephrogenic systemic fibrosis, which sounds like a sci-fi villain and can mess with your skin and organs. Plus, studies, like one from Radiology in 2019, found that about 5% of seniors getting contrast MRIs had stroke-like symptoms, headaches, dizziness, blurry vision, within a week, especially if their kidneys weren't tip-top. Harold, a 79-year-old from Arizona, got an MRI for back pain, not knowing his kidneys were struggling. 2 days later, he was foggy, weak, and dizzy for a week. His doc later found stage 3 kidney disease. To stay safe, ask, can we do the MRI without contrast? If contrast is a must, request a kidney function test, a simple GFR blood test first. And always mention if you've had weird reactions to scans before. Finally, let's talk about carotid artery ultrasounds, those quick, non-invasive scans to check the arteries feeding your brain. Sounds harmless, like a peek under the hood, but here's the catch. If you're symptom-free, this test can lead you down a risky road. Say it shows 50–60% narrowing from plaque, normal for aging arteries. Suddenly, you're sent to a surgeon for a carotid endarterectomy or stent. But if you had no symptoms like dizziness or vision issues, these procedures might not help and could even cause a stroke. A New England Journal of Medicine study found that for seniors with moderate narrowing but no symptoms, surgery didn't always beat meds and lifestyle changes, and some folks had strokes from the procedure itself. Helen, 82, from Pennsylvania, had a routine ultrasound showing 65% narrowing. She felt fine, but got surgery and ended up with a stroke, leaving her with partial weakness. Protect yourself by asking, what are we looking for and what happens if we find it? If you're already managing your health, extra scans might just cause stress. Get a second opinion before any surgery, and don't let a number on a scan scare you into the operating room.
Alright, let's wrap this up with some straight talk and a sprinkle of encouragement. Because your health is your superpower and you have got the weed. We have just walked through 5 common medical tests: CT scan with contrast, stress test, endoscopies, MRIs with contrast, And carotid artery ultrasound, that might seem like no big deal but can carry sneaky stroke risk for folk over 60, especially if your body already juggling things like high blood pressure, heart issues, or kidneys that are phoning it in. The truth is, modern medicine is amazing, but it's not one size fits all. And sometimes those routine checkups can stir up trouble if we are not asking the right question. You are not just a patient, you are the boss of your health, and every test should make sense for you, not just some checklist your dog's following. So next time you are at the clinic, don't be afraid to put on your detective hat and ask, is this test a must? Are there safer ways to get answers? Share every detail of your health history, meds, past reactions, all of it, because those little clues could make a big difference. If something feels off, like a test is being pushed just because it's standard, ask for alternatives like a non-contrast scan or a less intense heart check. And if a test shows something like artery narrowing, but you are feeling fine, don't let fear rush you into surgery. Get a second opinion, maybe even a third, because your peace of mind matters. Studies like the ones we mentioned show that being cautious and informed can cut down risks, and real stories from folk like Jim, Margaret, and Helen remind us that these are not just stats, they are lives. After 60, it's not just about catching problems early, it's about avoiding once we might accidentally spark. So take charge, trust your gut, and don't let anyone make you feel like just a number in the exam room. Drop a 1 in the comments if you have ever questioned a test or had a weird experience after one, or a 0 if you are all ready to start asking tougher questions. Subscribe to Health After 60, because we are all about giving you the tools to to stay sharp, stay safe, and keep living your best life. Knowledge is not just power, it's your shield, and we are here to help you.